Hi everyone, we are here in the nation's capital in our new old federal building. We are getting excited to start our webinar, but we are seeing that folks are still joining. So we're going to give them just a couple more minutes and we will get started shortly. Hi everyone, welcome again to the Moving Forward with the Early Head Start and Child Care Partnerships webinar on highlights, lessons learned, and early successes. We're going to jump right in just a second. Before we do, I'm going to give you a few quick logistical announcements. First of all, you'll probably realize that your phones are on mute. That is so that we can avoid background noise. It doesn't mean that we don't want to hear your questions. We definitely do. So if you've got questions or comments throughout, please feel free to use the chat box and your question feature and send those our way. Our hope is to be able to answer those at the end, but if there are questions that we don't get to, we will still have a record of them. So please do feel free to send your questions to us throughout. Finally, we will inevitably get a question about whether or not the slides are available. They are not currently available, but they will be. Within the next couple of weeks, we're hoping to post the webinar slides to our website, and when we do, we will send out a note letting you all know that the slides have been posted. So without further ado, I will hand it over to our Deputy Assistant Secretary for Early Childhood Development, Linda Smith.
Well, thank you, and welcome to everyone who's on the call. We're very excited about this. This is part of a planned series of events where we now want to go from implementation to actually sharing what we've learned through the partnership experience so far and helping get people sort of up to speed with the successes that we've had. And believe me, we've had some enormous successes in a very short period of time. So before we get started, let me just recap, because I think it goes without saying that this has been sort of a modern miracle when it comes to government, to say that we just got money in January of 2014, and by March of 2015, we had stood up a program that was all by itself very unique for early childhood. And so it took a lot of work on a lot of people's part, but with many successes. So after we got the $500 million that we were given, we got those awards out to over 275 grantees around the country, one in every state, which we were extremely happy about. After that, we followed that up with the 6 regional orientation sessions across the country, where we had almost 2,000 participants in those orientations, which went amazingly well, and we learned a lot. We got a lot of good feedback, and it helped us come back here and then take some of the next steps, which were to get out the information memorandum that we put out on the policy and sort of program guidance. We used the questions and things that we got out of the orientations to do that. We did conduct virtual post-orientation sessions with the partners during the time after that on different topics, and all of those stemmed from what we learned during the orientation. So those were very helpful to us. Then as you know, we've continued to work in a forward motion on this, and did manage to do 236 environmental health, safety, and fiscal assessments, on-the-ground assessments, which I just came back from a site that had been visited recently, and it was all positive. The response to what we learned in those visits, as well as what the grantees learned, I think was all things said and done, a very positive experience for everyone. So now, as we move forward, this webinar is a part of what we are going to do to start to call attention to what we've learned and the successes, as well as to gear up for the next phase, which will be 12 regional meetings across the country after the first of the year to take this to the next level. So a lot of work going on with the partnerships. But in summary, let me say that I think it goes without saying that what we're seeing across the country is, in my view, nothing short of a miracle when you see what's going on between Head Start and child care. And I can say that in my experience, this is a first to have programs not just talking to each other, but really finally figuring out what each other is all about, and that there's not as many myths about Head Start as there used to be, that child care is really seeing a path forward in terms of the quality and how we can begin to build from these partnerships. So all things said and done, we think that this is working, and that the spillover of these partnerships, it goes well beyond the 275 grants that we have put out there, and beyond just those partners who are involved with those grantees, but much beyond that. And I think you're going to hear that today from the two people who are going to present later on and talk about the work that they've done. So I'm going to turn it over to Melissa Brodowski, who's going to give you an overview now of where we are with the partnerships, and then from there we'll move on to talk with Rachel and Blanca about sort of where we are with the Office of Child Care and Head Start.
Thank you so much. And as you can see from the next slide, we just wanted to share with you kind of the landscape, the national picture of these new partnership grantees. So at the top, we're excited, as you heard, we have these 275 partnerships and expansion grants that were awarded, but we're really excited to share some of this data, and we know these numbers are actually still going to continue to increase. But right now, there are 600 family child care partners, 1,100 child care centers that are partnering, and from that, there are actually 2,900 partnership classes that we see the children will be enrolled. As you can see, this is data as of October 30th, but we expect to enroll up to 32,000 infants and toddlers, and right now we're just so excited. We're over the 50% mark. We feel like we're making really steady progress, and really thank all the grantees that are out there doing all this great work to support this implementation. We're also tracking, because we recognize there'll be other benefits to other children who are in the same classrooms with the enrolled partnership children. So right now, we're tracking about 5,300 children that are also benefiting. Again, this is likely an undercount, because we know there'll be other benefits to other children in the centers, from the classrooms, the playgrounds, etc. So we look forward to sharing more about these numbers as they go up over the next couple of months. The next picture, just to share with you where these partnerships are, we have a map. And really thank the Head Start folks. All that program information data that you're sending to the Office of Head Start has plotted where the different centers and partners are across the country. And as Linda mentioned, there's one in every state, and you can see the early Head Start sites, as well as the migrant and seasonal early Head Start, and then the Alaska Indian and American Native grantees as well. So we're looking forward to sharing more information as they progress, and part of what today's webinar is to share those success stories. Again, right now we only have about, we're expecting probably about 30% more increase in the reporting, because right now this is as of 70% of the locations being reported to date. So with that, We're really excited to have the two directors of the key partners involved in this work. And so we wanted to spend a little bit of time hearing from both Dr. Blanca Enriquez and Rachel Schumacher, the directors of Child Care and Head Start, around what these partnerships mean to them. So I think what I'll start with is with Rachel. If you could share a little bit about what these partnerships mean for the Office of Child Care, especially in the context of reauthorization.
Well, thank you so much for that question, Melissa. I think that's a really appropriate question to ask. So as I think Linda alluded to, this administration has long been committed to a vision where children and their families have access to the level of quality and services that they need, regardless of what door they walk through and what the name over the door is. And the partnerships fits right into that vision and also into what is really a new creative era of reform for childcare. The Office of Child Care has been working really closely with our partners and state administrators around the country because we have a new law that was reauthorized last year, almost a year ago as of next Thursday, the CCDBG Reauthorization Act, which really changed what the vision is for child care through that program in this country and moved it and really set forward a pathway, I think Linda said, toward higher quality and more continuity of care and other goals that we have long seen as very important for children in the child care settings, just as they are for children who are in Head Start and early Head Start settings. So we're really excited about that. We see a lot of movement around the country with states, state administrators in child care looking at their partnerships in their state or actually being grantees, thinking about how do we get to that vision, what are some things that we can pilot through these partnerships that will add to continuity of care, add to higher quality, and that may someday be something they can expand given the provisions of the new law, which really say a new purpose of the law is to move more children into high-quality programs, more low-income children into high-quality child care, and to really engage families in the development of their children in child care settings. And these are very important goals also and have been for many years, 50 years, in the early Head Start and Head Start programs. So we're excited to be able to pilot and see these changes around the country and hope that these types of things that are in the law around focus on infants and toddlers and expanding the continuity of care of children in the subsidy program and lengthening eligibility really add to and expand the opportunities to make child care move toward that vision.
Great. Thanks, Rachel. We wanted to give a chance then for Dr. Blanca Enriquez to talk about the Office of Head Start and your vision for where you see these partnerships fit with your priorities.
Thank you, Melissa. The partnerships really fit beautifully with the priorities of Head Start. As Head Start is focusing on key program areas such as improving the quality of services, assuring safe, secure, and healthy environments for children, growing the capacity of our teachers, increasing partnerships, supporting the leadership at both the regional level and the local grantee level, and building on Head Start's work in comprehensive school readiness and family engagement. It has been my experience that Head Start preschool programs cooperate with child care providers in many, many ways. However, in these cooperative agreements, most often each program stays in their place. Head Start in their centers and child care in their centers. So the big difference with the early Head Start child care partnerships is that now we are working in the same space. Every early Head Start baby and every child care baby in the same space, with the providers maximizing on the lessons learned in early Head Start about what works best for the optimum development of children ages 0 to 3, and enriching their curriculum, enriching their instructional materials, and the classroom and playground environments. In addition, the partnerships are also expanding the early Head Start reach. Did you know that the early Head Start program serves less than 5% of our most vulnerable infants, toddlers, and families in this country? However, through the early Head Start child care opportunity, we are reaching more babies, where they live in family child care and child care centers that serve our families who are working long, long hours. As you can see in the map that we showed you, we have partnerships from Alaska to Florida to Maine, from Wisconsin and Santa Clara Pueblo, New Mexico, to the heart of New York City, Chicago, and Los Angeles. So our reach is extensive, but it is also deep. One of the primary benefits for our children is the security of continuous quality relationships and routines at the most critical period of development in their lives. And one of the many benefits for families is support in accessing needed health services, as well as experiencing the long-term relationships and benefits themselves as well. Already we have over 1,000 child care centers and over 500 family child care homes in our network, and we have enrolled over half of our expected numbers of children. Just think of how many children beyond our expected 32,000 are already benefiting simply by receiving care in the same centers and homes. You know, the partnerships have also increased the capacity of the staff in the homes and centers. Previous to the partnership, the staff often found it hard to make ends meet. And this project is not only increasing the quality of environment and providing more resources and equipment, but also increasing the salaries, increasing access to professional development, and supporting the completion of credentials of the teaching staff. It is important to note also that the partnerships have had a positive impact on our regional offices. For now, regional program managers from Head Start and from Child Care are sharing ideas, working closely together, and taking the lead in supporting and assisting our local early Head Start grantees and the child care providers. So you can see that the goals of the Office of Head Start are one and the same with the Early Head Start Child Care Partnerships. And we expect to successfully accomplish more in the months and in the years to come.
Thank you. That sounds great. I know now we'll definitely have more time for discussion towards the end, but I wanted to allow Dr. Enriquez to introduce our first grantee.
Yes, it's exciting that we also have with us some Head Start grantees and child care providers that will talk to us about their experience. And it is my pleasure to introduce Dr. Jayne Winkel, the Program Director for the Schoenbaum Family Center, also known as SFC, at the College of Education and Human Ecology at Ohio State University. In this capacity, Dr. Winkel leads the outreach efforts of the center. You know, Ohio State University has been providing Head Start and Early Head Start for the last 7 years, and the staff here has extensive experience with partnerships that support high quality early care and education. With Jayne's leadership, she's been very, very instrumental in creating successful implementation of several partnerships between the SFC Spark program and the Winesland Park neighborhood, which really has led to excellent relations with the Winesland Park Elementary School. Jayne has earned her PhD in education from Ohio State University and was also previously Associate Superintendent for the Ohio Department of Education and President of the National Association for the Education of Young Children. And here I introduce Jayne Winkel.
Thank you, Blanca. I appreciate it. Thank you very much. And good afternoon to everyone. First and foremost, before I start, I just want to say thank you to the offices of Head Start and Child Care, and also our regional office, one for providing us the opportunity to share our program today, but also want to say thank you for the conversations, the support, and the patience in a way to help us think through some of these things as we've been working through implementation. It's been greatly appreciated and extremely helpful, so thank you for that. So to start, I'm going to look at the next slide, which I'd like to give a little bit of context for our particular Early Head Start grant. We started, as was mentioned in my introduction, Wineland Park, which is in one of the zip codes. This map that you're looking at is a map of Franklin County and all the zip codes. And we're focused on the city. But really what prompted this, the university in partnership with the Weiland Park community, which is philanthropic, corporate, and individuals, was really looking at revitalizing the Weiland Park neighborhood. And as a result, we are one of the recipients of one of the two-generation funded projects by Annie Casey. All that being said, what it did, it highlighted for us in this 15 square block area that has a concentration of subsidized housing as well as mixed income housing and rental. But what we learned in our work was that we had 191 children, 3 and under, living in that neighborhood that did not have access to high quality early care and education. And while the Schoenbaum is a high quality provider and center, didn't have the capacity to address the needs of that large of a population. The next part of that, what really happened was we began to learn that there was this potential of new funding that was going to be available for Early Head Start. And so with that, thought maybe this was going to be the way that we could begin to get some resources to address the concerns and how we were going to provide increased access. So what that led to was a deeper conversation with our Community Properties of Ohio, which really is responsible for the subsidized housing across the city. And when we really got into this, it was like they have pockets of concentrated housing all over the city that were in the same need that we saw in Weiland Park. So we began to identify, having knowledge of Early Head Start and a lot of the requirements and the expectation for comprehensive services, we began to gather potential partners and interested parties and stakeholders to talk about this possibility of funding and was it something that we should pursue. And I mentioned that because it's really important. We started meeting for months before we ever knew the money was even available. And in those months of meetings and conversations, we co-created the vision for what we wanted to have happen in the service of these young children and families across the city. And so it really led to a shared vision about what we wanted to see happen and why. And the other part that I like to share is in those months of conversation, not once did any provider at the table, any agency or organization at the table ever ask about how much money this was going to mean for them. We really coalesced and had synergy around a desired vision for change and to make a difference in what would happen in the lives of children and families that we wanted to help support and serve. So in the next slide, it gives you some sense of the partnership. One is, again, I think we began to gather, as I mentioned, and really wanted to help folks understand expectations of Early Head Start. And in those conversations, it became very clear as to what each of the partners, both if they were a family child care home provider, a center provider, or one of our agencies, about what they could contribute. And in that contribution, understood where the gaps might be, and in that knowledge of understanding where the gaps might be, led to more partners or identifying other agencies that we felt needed to be at the table. And continued to invite folks. And I want to share a quote from one of our partners because I think it speaks to what we have learned so far and kind of the feelings. But it says, the partnership aspect of the OSU EHS project is so promising, and not just because of all the impressive list of partners named. It is because of the vigorous effort to maximize the assets each partner has to offer and to integrate their strengths for the greatest benefits to children. I am so impressed with the leadership skills, the energy, and the responsiveness of OSU EH administrative staff, and I really think as a partnership we can raise the bar on quality outcomes for infants and toddlers. And I think the other part that I've always believed in from my work at the State Department and what I always believed was the intention behind Head Start was how do you maximize and leverage existing resources and bring those resources together in the best interest of what we need to have happen. So as a result of these conversations, another example would be that there was a need identified around how we were trying to work with families who were eligible for child care subsidy. And as a result, the group identified that we were having challenges with communication from the County Jobs and Family Services, having challenges around redetermination. But to make a long story short, what happened is they're now one of our partners at the table. And through their partnership, they have dedicated a caseworker for us. And in fact, we are in the process of doing a pilot project with them to understand how we can expedite applications, how we can get better communication to the providers so they know the status of families, and also look at how we could reduce the number of touches on an application on both sides. So I think, again, that's just an example of conversation and dialogue and working together and what it can be. And I have to say that I honestly believe the other key part for us in all of this is the staff that we have. We have an incredible staff, small but mighty, that were hired through these funds through Ohio State. And we were very conscientious and intentional about how we hired and who we hired so that we had a balance of folks that know early Head Start and Head Start standards and programming, and folks who have expertise in early childhood education and that were open and willing to think outside the box and be creative in their problem solving. Next slide. So as a result of all of the partnership, we have at this point in time across the city 11 centers that you can see on the next slide in the map, maybe. Hello? Hello?
Yep, we're forwarding the slides. I don't know why they haven't come through for you, but we're on the map slide.
All right, that's good. So anyway, in this map, you'll see that we have 11 centers and one more that we would like to start. We have 6 homes with 6 more that we are interested in establishing. And we were very, in this first round, I'd say very selective. We worked with an organization called Caring Communities Birth to 3. It had been working with quality rated centers that were looking at mixed age grouping. And then we worked with Action for Children, our resource and referral agency, on helping identify family child care homes that were looking at becoming rated or in the process of going through the rating system. And then began to look where they were strategically placed in our high priority zip code. And so that's where we are in that. The interesting part is that as a result of all the energy and conversation this has raised, that we actually have partners, providers coming to us and wanting to know how to become a partner. Unfortunately, we've maxed our 160 children that we have for enrollment, but it's a nice problem to have that people are now going to start coming to our partner meetings to learn and understand with the eventual expectation and aspiration that we have that there'll be additional funds and we're going to expand. The other part that I think I want to share that just, again, the energy and the interest that what this has created. In the 43201 zip code, which I was sharing in Wyland Park, we don't have any more centers or homes that are established because we've made a commitment. We would work with existing centers and homes if they were in the targeted neighborhoods. In this particular case, we don't have any. And there's also a zip code that's concentrated on the edge of our downtown area. And so there's an exciting new partnership that's happening that is with the Community Properties of Ohio that does our subsidized housing, and Campus Partners, which has really been instrumental in the development of properties in our neighborhood. And they are going to finance for us the development of a center and 3 family child care homes that will be in the Wyland. The center will be downtown area. The 3 homes will be established in the Wyland Park neighborhood. And based on a job training program that we had at Ohio State to a very generous gift, we had an opportunity to identify residents of the neighborhood who wanted to become early childhood professionals. And they actually worked at the Schoenbaum Family Center and were part-time assistants in the classrooms and then actually received their CDA and support through the university. So we're looking at 3 of those individuals to actually be the providers in those family home settings. So the next slide, the other concept that came out of our vision was around this idea of creating 4 neighborhoods. And in each one of those neighborhoods, there's multiple zip codes but one of the centers would serve as a hub. And so they would be the site of supports for each other, whether there were other centers and home providers. They would be the site that we could do family engagement activities, provide professional development opportunities, but then in each one of those neighborhoods that we would connect those neighborhoods across the city. So trying to create this neighborhood, this connection, this network, and this community of learning as we got into this project. So the next slide is another quote that I'd like to share from one of our providers. And I think the point here and what we're really learning as we proceed with our implementation, that again, as I want to mention, it has a lot to do and everything with staff, and they have the different experiences and perspectives and moving things beyond the way we've always done it. But the other part that's been really key is about building strong relationships. And those relationships that are built on trust and a shared passion for working with families as a foundation and the integration of services. And it's been really good to have our partners, both our family child care home providers, our agency partners, our staff, and our child care centers, meeting together, because in that way they really hear from each other, and we're building a shared understanding of, here's what I do, here's how it contributes to this overall project. And it really has created a greater appreciation at all levels for what everybody, both challenges they may be experiencing, but also the contributions that they're making to this effort. So it really is about mutual respect and appreciation for the work each person's done, each entity's done, and what they're doing. So relationship building has really been a huge part and a working element of what we've been doing over the past few months. Next slide then, just to highlight a few of the lessons we're learning. Top one I've already mentioned, that I think you need to have a shared vision for change. And we started with that vision and everybody buying in and being a part of it and believing in it. The other part I think is, the other part to that I think is important. Everyone's committed to quality, and quality is important. But if the individuals don't share that vision for change and a willingness to collaborate, then we have a partnership, but not necessarily the change that we're looking for. The other part, I think, is, as I've mentioned, the value in the leveraging and the benefits of leveraging our resources. The other part that we've learned is people have to understand it had to be mutually beneficial. You know, it's interesting. We have our nationwide children's hospital when they're at the table, and they're providing all the medical services and supports, and actually what we call a responsive services team, where all of the comprehensive service providers come together and triage a family or the needs of that family, and then they facilitate how services are going to get delivered and the follow-up. But, you know, the comment was, these are the families we're supposed to be serving. And so coming together to know who those families are and the mutual benefit that the leveraging has brought. The other thing that became really important for us was we actually worked with a facilitator with our staff to spend time really clarifying roles and responsibilities because of the complexity of all the partners and the clarity that we wanted to make sure people knew who was doing what, when, why, and how. And the other part of that facilitation was getting it clear decision-making. Who has the authority to make decisions at what level, and how those decisions would get made, so that we had processes in place in terms of how we function in our infrastructure in terms of operation. And then I think the example that, and the belief is also, is how to leverage this early Head Start funding and the expertise and the energy and the attention that can benefit early childhood overall. Both infants and toddlers, but also the teaching staff at the centers and the providers, the home providers. I think, you know, it's raised a level of attention in our community and how to advance collectively some things that we hope to make happen in the early childhood field. So in the last slide, just also with great learnings comes challenges and opportunities. And the one obvious opportunity has been that most of our providers, high quality rated and leveraging and looking at blended funding, have really lived on a shoestring for the most part. And so the resources that this has provided in terms of looking at environments, which in many ways we believe environments are like the third teacher, that we've been able to provide outdoor playground equipment, classroom equipment, the technology needed for data collection and reporting, but it has really created a change in the kind of environments that we want to provide for our young children. And the other part of it is it has raised the level of awareness that we have incredible early childhood expertise. But now with the complexity of what it takes financially to really be self-sufficient and self-sustaining, really looking at how to help centers and homes build really business plans and to understand their revenue streams and their expenditures so that they really do have a balanced budget in terms of operating. The other challenge that we have faced is the workforce. And so we actually have classrooms that were delayed in opening, or in one particular center were not able to participate because could not find qualified, competent staff. So we've really been working with the university and other partners around this workforce pipeline from high school to CDA to 2-year and then 4-year institutions. The other opportunity that's created for us being at the university and actually housed with the Crane Center for Early Childhood Research and Policy, we're going to be able to do some pretty extensive evaluation of our partnerships and understand our work together and really be able to speak to the collective impact that we believe this partnership is going to provide, not only in terms of understanding growth and development of children, but really interested in the potential impact this can have on the parent social networks that get created. A challenge that we've had, and one we're hoping at some point be figured out in a different way and understand why it's there, but it's been the adult-child ratio. In our centers in particular that are quality rated in Ohio, our rating system allows for 10 children in a classroom in a group size with 3 qualified teaching staff. And so we're trying to stay with our mixed age group and mixed incomes in our classroom. It's been a little challenging to reduce our numbers down to 8, and that also has shifted the staffing pattern. The last two I want to comment on is just the financing structure for us. We, as a grantee, did not anticipate, or probably on our end, think through our budget well enough regarding foster care and homeless children. So we are in the process of right now of looking at how to leverage the dollars that we do have to better finance a center or a home provider in particular if a parent loses their child care subsidy, or if in fact it is a foster child which is not eligible for subsidy in our state, or a child with a disability who may not be eligible for subsidy depending upon the income of the parents. So that's one of the challenges that we're looking at. The last one I would say is just, again, helping providers understand, and we're doing a crosswalk between our licensing standards, our quality rating standards, and our early Head Start standards, so that our providers really understand the relationship and that it's not a duplication of effort or why the standards are in place that are there. And in so thinking through that we really do reduce administrative burdens or not requiring additional pieces of work or paperwork or whatever, if that particular standard is already covered in some other way through some other part of what we do. So it's been an incredible journey. It is, the energy is high, the excitement is strong, and I would say the anticipation for us to continue to grow is what's really there, and it's just been an amazing opportunity and a true privilege to be a part of, and I can't thank my colleagues and my team back in Ohio enough for all that they're doing to make this really possible for our infants, toddlers, and our families. So thank you.
Thank you so much, Dr. Winkel. That was really an inspirational story, I think, of all the people you've been able to bring together to really make this happen at the local level. And I think, as Dr. Enriquez says, one of the wonderful successes we've been seeing she mentioned is the collaboration at the regional level, at the state level, at the local level to really make these things happen. So we're going to turn now and ask our next grantee to share her perspective. I'm so pleased to introduce Carol Hartman, who is also has been working for years and years to build sustainable systems and partnerships to really bring comprehensive services to Georgia's most vulnerable children and families, which is, I think, the opportunity we have in front of us here. Georgia is one of 7 state-level grantees that received the Early Head Start Child Care Partnership. And the Office of Child Care has been working really closely to create a learning committee among those states because, as I said before, we are very excited about capturing the lessons learned about what, leveraging the Early Head Start Child Care Partnerships lessons can mean for state policies in the long run. Carol Hartman is the Director of Policy and Systems Reform, love that word, at the Georgia Department of Early Care and Learning, where she has over 15 years of experience managing programs and services funded by the Child Care and Development Fund, CCDF, and has been the CCDF administrator for 3 years. She has been involved in a range of things related to CCDF administration, including subsidy, quality tier rating, professional development, and bringing the program for infant and toddler care to Georgia as a replication model. She also wears many other hats because she's been involved in directing and planning the Federal Early Head Start Child Care Partnership grants, which she's going to talk about now, and is on the leadership team implementing the Race to the Top Early Learning Challenge project in Georgia, as well as serving on the leadership team for the Federal Maternal, Infant, and Early Childhood Education Home Visiting Program. So, Carol Hartman, we're so glad to have you here. Take it away. And if you are on mute, you might want to unmute yourself, Carol, because we cannot hear you.
I'm sorry. Thank you. It's an honor to be here. On my first slide, I want to just provide a little context, again, about who we are at Bright from the Start, Georgia Department of Early Care and Learning. We go by our acronym DECAL. And we're one of 3 standalone agencies that's solely devoted to the education of children birth to 5. DECAL was created in 2004 by an act of the legislature and then Governor Sonny Perdue, and we're responsible for meeting the early education needs of Georgia's children. As you heard from my resume, we kind of do a lot of stuff here at DECAL. We administer Georgia's voluntary pre-kindergarten program. We license child care learning centers and home-based child care. We administer the CCDF subsidies and quality initiatives as the lead agency for CCDF. And we administer 2 federal nutrition programs, the Child and Adult Care Food Services Program and the Summer Food Services Program. We also house the Head Start Collaboration Office and administer the Early Learning Challenge Grant. And most recently, we were awarded the Early Head Start Partnership Grant. So we're really lucky to have so many components under one roof because it helps across, it helps us leverage all of these initiatives to provide access and services to Georgia's youngest children. So in Georgia, there were 8 Early Head Start Child Care Partnership grants awarded. The good news for us is that the partnership grants increased the number of slots for Early Head Start in Georgia by 41%. But as was alluded to in the beginning, we still don't have a lot of spaces. In federal fiscal year 14, we had about 3,200 early Head Start spaces. This partnership funding provides an additional 1,300 spaces or so in the state. Now, it's interesting in that DECAL has two different roles in the Early Head Start Child Care Partnership Grant. The first role is that of a grantee agency, and the second role is that of our CCDF lead agency. So I'm going to kind of talk about both of those roles and what that means. So as a grantee, DECAL was awarded $3.8 million a year for 5 years to expand Early Head Start in the metropolitan Atlanta area by partnering with early education programs that deliver high-quality comprehensive services to infants and toddlers and their families, and to create 2 early education hubs to support the early education programs to deliver those services. So in a sense, we're creating hubs like you heard about in the Ohio model here in Georgia. As the lead agency for CCDF, we're also committed to promoting access to early Head Start comprehensive services for children and families who are eligible for subsidies, who are also eligible for Early Head Start. So we have been working with the other 7 grantees and their partners to layer the subsidies for dually eligible children and families. So next I'll provide just an overview of our Head Start partnership as DECAL as the grantee. And then I'll provide a little overview of our work with the other grantees and their partnership. So this is a visual of the DECAL partnership. With our partners, we use the shared service approach to support the delivery of comprehensive, culturally competent services for children and families. We, like Ohio, began meeting with all of the existing Head Start and Early Head Start grantees and potential partners before the federal opportunity announcement was released. We wanted to open ourselves as a state agency and say, we've never had Early Head Start before. We can administer pre-K, we can license programs, but this is a new experience for us. We're interested in seeing how this works, and we're eager to have you partner with us. As a result of that, we identified 2 agencies to be hub for services. One is Sheltering Arms Early Education Center. They're an experienced Early Head Start and Head Start grantee, and they're the hub for 5 partnering child care centers which serve 144 children and their families. And they also developed a model infant-toddler center. Our other hub is Quality Care for Children, which is a resource and referral agency with a long history and track record in Georgia of helping programs improve quality. And Quality Care for Children supports a cohort of 16 primarily Spanish-speaking family child care providers who are quality rated, which is our quality rating and improvement system. And those providers are serving 40 children in Early Head Start and their families. And if you look at the range of centers, you can see that we have a technical college child development center, we have a for-profit center, we have centers that are nonprofit. Scottsdale Development Center serves a high number of refugees. The Our House Genesis is located in a homeless shelter, so children and families experiencing homelessness receive early Head Start services. And of course, with our family cohort, we have many children who are dual language learners enrolled in those programs. By October, our schools here in Georgia start early in August. So most of our centers and family child care homes began delivering services in August. So by October, we had 184 infants and toddlers enrolled in early Head Start. We're really excited about this grant because it offers us at the department the opportunity to continue to build an integrated service delivery model. We're able to leverage funding streams from our CCDF quality dollars to help all of these programs become quality rated. We're able to leverage some of our early learning challenge funds with lessons learned about how to provide subsidies and layer subsidy funds, because we're doing that through our early learning challenge projects, and also providing professional development and doing a lot of work around family engagement. So all of our Head Start partners will be able to be involved in those projects that are funded through the Early Learning Challenge Grant, as well as the opportunities available through Early Head Start. We also have philanthropic funding similar to Ohio, which is related to our quality rated system, so that programs that achieve a star level in quality rated receive additional materials and equipment. So our Head Start programs, not just decals grantees, but any Head Start program in the state is eligible to participate in quality rated, and in fact about 44% of the Head Start and Early Head Start programs in the state are already participating. So now I want to shift gears and discuss our department's role as the lead agency in layering subsidies. This slide shows where the Early Head Start Partnership grantees are located. In Georgia, we have 159 counties. And the counties that are highlighted are counties that have Early Head Start Partnership grants. We are working with all of the grantees and their partners. Again, 7 grantees. Right now, there are about 40 existing early education programs which are partners. We expect another 10 will come on board in the next few months. So it's our commitment as a CCDF subsidy lead agency to make sure that all of these partners have access to subsidies so that they can meet the 25% or 40%, whatever they proposed in their grant for their children. So how do we layer these subsidies in Early Head Start partnerships? In Georgia, we have long had a certificate or voucher program for subsidies. So we really built on our long-term collaboration with our Head Start grantees. Georgia has layered Georgia pre-K funding for 4-year-olds with Head Start funding and had mixed classrooms for a long time. And that has enabled the Head Start to serve more 3-year-olds because the portion of the day that is funded by Georgia Pre-K has kind of freed up some funds. So we kind of took that approach for layering our subsidies with our Early Head Start partners. And we have a really strong Head Start collaboration office that has fostered a lot of trust and communication along with our Georgia Pre-K program. So DECAL established grant agreements with each of the Early Head Start Child Care Partnership grantee agencies, and then each of the partners that they identified. So the grant agreement specifies the number of children who will receive Early Head Start services and subsidies at each of the partner sites. Now, it's important to note that the Early Head Start grantees retain overall responsibility for the federal grant and all of the services delivered. As DECAL, in our role in this partnership, really is just to make sure that the children who are eligible for subsidies do receive those subsidies. So the grantees select and support and they monitor the partner programs to ensure that they're meeting the standards for Head Start, as well as any other applicable regulations, licensing, and that sort of thing. And they provide the quality assurance and they monitor the service delivery. Each of the partner programs, the child care programs, provides those full-day, full-year Early Head Start services for eligible children and their families. All of the partner programs have agreed to participate in Quality Rated. They may not yet have completed the process and have a rating, but they have agreed to participate, which means they're receiving the technical assistance, they're preparing their portfolios, and they're getting those Quality Rated supports, which also is provided through another funding stream. Partner programs submit their invoices requesting reimbursement for subsidies as often as weekly. We literally modified our provider management and payment system so that we could issue subsidy payments to the partner programs based on the number of children that they are contracted to serve, rather than based on the individual vouchers. That also required us to do some work here at the state level to be able to gather data on the children who are in those partner programs so that we'll be able to report that data on our federal CCDF annual report. So we know the grantees are reporting that just like we are. DECAL is a grantee to the Office of Head Start, but we also had to be sure that we were able to collect the data to report on any child who received subsidies through these grants. So we're reimbursing the grantees directly through electronic funds transfer for the Early Head Start services. The next slide. So while the grant agreement is the mechanism to layer the subsidy funding, we also had to do some additional work to align the subsidy program policies and processes to support the partnerships. We're revising and implementing subsidy policies to support the families who are enrolled in the Early Head Start Partnerships program. We had to look at eligibility determination. We have an annual eligibility determination process, and of course we want to promote the continuity of care. Thankfully, reauthorization has given us a little more flexibility in terms of change reporting, so that a family who is receiving subsidies and may have an increase in income or may lose a job for a period of time could still be eligible for subsidies, which has a huge impact on our Early Head Start partners because they count on those funds as part of their budget. So that kind of flexibility through reauthorization has been extremely helpful for us. We've also looked at our work requirements for families for subsidies, and in Georgia, each adult is supposed to be working in school, in job training at least 24 hours a week. In some circumstances, that isn't feasible, so we have looked at policies so that their volunteer hours can count. So those are just some of the examples of some of the flexibility and the changes that we're able to make in CCDF. So the last slide, because I know we're running out of time, is just we're excited about the system building opportunity as a state to not only enhance the quality of care for infants and toddlers, but to really look at how this grant focuses on the department vision of improving quality, not by building programs, but by building the system and building connections between the programs that already exist. So we're excited to be doing this, and I will turn it back over to you, Melissa.
Thanks so much, and we really appreciate everyone hanging in there. We recognize that we really wanted to give both you and Jayne enough time to share what you had to share, so we're just hoping folks can stay for another 10 minutes. We know we got a couple of questions on the chat that we can easily respond to, and then want to give folks a chance here to reflect on what they've heard too. So one of the questions was, what were the other state grantees that were funded? So Alabama, Delaware, the District of Columbia, California, Pennsylvania, and the Northern Marianas Islands are state grantees, but clearly there's also a lot of exciting policy work that's happening across other states related to CCDF that's supporting the partnership. So I wanted to see if Rachel wanted to chime in on a few of those things, just to share some of the things that's happened there.
Yes, thank you, Melissa, and thank you, Carol and Dr. Winkel. We are very excited to say that there's extremely exciting information coming out of our grantees who are states, but we also have states that are not necessarily a state grantee for Early Head Start Child Care Partnerships, who have been very supportive of the partnerships in their states and interested in making changes to their subsidy programs, for example, by matching eligibility for subsidy to Early Head Start. We have at least 6 states looking at that. 8 states waiving co-payments for children who are in these Early Head Start Child Care Partnership opportunities when the children are under the poverty level, which, as we know, Early Head Start programs are mostly targeted to children under the poverty level. Then those families do not have to pay a co-payment for the subsidy portion that's also helping fund their slot. And we have, in addition to Georgia, at least 4 other states looking at using contracts or grants to the partnership sites, the child care partnership sites, to help them secure subsidy slots for eligible children who can be in the Early Head Start child care partnership slot. So we're really excited to see that supportiveness in states, even if they're not necessarily the grantee at the state level, but looking at how to make these programs successful and hopefully looking at the opportunities to expand these kinds of policies to other children and families who are in the CCDF program, who are low-income working families who could probably just as easily benefit from these types of changes in their subsidy policy.
Great. And I know there's a couple of other questions, but I wanted to also give Dr. Enriquez a chance to, if there were some other things you wanted to share in terms of reflections and successes before we try to answer some of these other.
Yes, absolutely. The many stories that we have heard and that we have seen while we have visited some of the early care and Head Start centers have been just so heartwarming and outstanding, and they go beyond improving environments and equipment. There was one partner that talked about how the teachers were kind of sad because they had completed all the paperwork necessary to get their CDA, but they did not have the funds to complete the application. And so the partnership was able to provide that funding so that they could go through their CDA application and receive it. So they were really excited about professionalizing their work. Another partner told us about how excited parents were to be able to have support for diapers and for formula. So it is those things that sometimes we think are very little and minor, but for our parents and our children, they are beyond what they have received before. Kind of like a funny story, you could say, but yet heartwarming, was this little one that had some serious sinus issues and had gone to several specialists. And then finally, the family service worker suggested to the mother that why didn't she go to their home doctor, you know, their medical provider, their medical home. And when she went, the doctor found that the little one had a piece of styrofoam stuck in his nose. So he got cleared. But it is those connections to medical homes that have been just so great for the health and the safety and the continued education of our children, as well as the connection that parents are making in the community.
That's a great story, Dr. Enriquez. When I had the privilege of visiting a family child care home in Connecticut, in New Haven, that is part of the partnership, I also heard a story. I was visiting and they had a little girl who was sick that day, and the provider was saying, I'm so thankful I have a nurse that I can call who will give me advice on what to do with this sick child now because I'm part of the partnership. So it really does make a difference, because as Dr. Winkel was saying, and I think Carol Hartman was also saying, is that we really have a chance to bring a range of resources that are often existing at the state or local level to help the child care providers do everything that they want to be able to do for their children and families who are working hard, and their children really can benefit from the same types of comprehensive services that one gets when you're in an early Head Start program. It's very heartwarming.
Great. And I know there's many more questions that we'll make sure to pass along to the presenters, but I wanted to pose one question to Linda in terms of, will there be future rounds of these partnership grants?
Well, as some of you know, Congress right now is working on the final budget. They did just get get a budget, and now they're working through the final appropriations committee. So there has been money both in the House and the Senate for partnerships. It remains to be seen what we get in the final. I think they're differing amounts in the House and the Senate, but all indications are that it's promising that we will have more money. Just how much, we don't know at this point. So we are hoping, though, that we'll be able to continue the work that we've been doing and expand it a little bit. I know that we really do have to, we're running out of time now. It's 10 after, and we've kept everyone, and we do appreciate people hanging in there with us on this. One of the things that I want to say before we close is that we are really wanting to do more of these types of webinars where we can showcase and help people learn from others who are doing this work. And I think we're sitting here in this room having learned something ourselves from listening to the two presentations that we just saw, as well as I'm sure that you all have also learned from them. So if you're out there and you would like to help us out by showcasing your program and what you're learning that you think might be beneficial to other people around the country, let us know. And if you have other questions about this or others that we can answer either here or refer to either Jayne or Carol, we'll be happy to do that. So we will work on getting answers to these questions. So I think I just want to give a shout out before we close this up to all of the people, the grantees around the country that worked on this over the last year, to our regional staff in both Head Start and Child Care, who've really done a yeoman's job of getting these grants out, to the state collab, the state administrators, everyone out there. This has really been a collective effort, and I think you can tell from the two presentations that we had today that it's really starting to pay off around the country. So thank you all for joining us. Thank you to the two presenters again, and let's share more stories. So let us know what you're doing, and we'll be more than happy to get the word out. Thanks again, everyone.
Thank you.
Thank you.